Many post-COVID-19 patients are still dealing with difficulty in breathing, elevated heart rate, fatigue, chest pain, and many more symptoms weeks and even months after getting the virus. These patients are being called COVID-19 long haulers, and a lot of them want to know when they may be feeling better so they can get back to normal. Joining us to share more about the challenges for long haulers is Dr. Lucy Horton, director of the UC San Diego Health Long COVID Clinic. Doctor, thanks so much for being here this morning. Really appreciate your time.
Good morning. Thanks for having me here.
I touched on some of the long hauler symptoms, but what are some of the treatments? What are some of the side effects people are experiencing out there of these long haulers?
Yeah, so you mentioned some of the most common symptoms that patients who continue to experience symptoms after their initial infection do experience, namely fatigue, difficulty breathing, elevations in heart rate, or kind of the inability to control heart rate and blood pressure. We see a lot of patients who continue to have neurologic and psychologic side effects, such as the sensation of brain fog, difficulty concentrating, memory loss. But really the symptoms are very wide ranging. Over 120 symptoms have been reported by long haul patients. And so every patient really has their unique combination of symptoms. And that's one of the reasons why it's such a challenging condition to both diagnose and to treat.
Do the symptoms get better? I've talked with other long haulers who feel like when they got the COVID-19 vaccine, that some of the symptoms were reduced. Are you seeing that in the people that are showing up there? Are they telling you that?
Yeah, it's a really fascinating question, and I can tell you I've seen a mix of everything. I've seen patients whose symptoms have improved either slightly or significantly after having the vaccine. On the flip side, I have seen some patients whose symptoms haven't changed at all after having the vaccine, and a few who thought that maybe the vaccine made them feel worse for several weeks afterwards.
Okay, interesting. Speaking of your research, more women than men discussing this and coming forward and saying they feel like they have these long hauling symptoms. What would be behind that potentially?
Yeah, it's a really fascinating topic, and we're just really not sure at this point. It could be a combination of who is, coming forward to ask for care, and women tend to come forward with these complaints more than men in general. But if we compare long COVID to some other chronic fatigue conditions that can occur after viral infections, those also had a predominantly women-heavy population. So there maybe could be some sort of hormonal or genetic component that we're not fully understanding yet.
We've been talking about in the news, especially past week, that some of the San Diego Padres players have tested positive for COVID-19. Is there a potential, just because of what they do, that they could potentially be long haulers? Any insight into any of that?
Absolutely. I think it's a little too early to know. Usually we don't consider somebody a long hauler until they've had symptoms for at least 4 weeks after initially testing positive. But unfortunately, anybody can be affected with long COVID. It doesn't really matter if your infection was severe or if you were in the hospital. And that's one of the things that makes this condition so devastating, is that a lot of the long haul patients were pretty young, healthy. I've seen many athletes, for example, who had a mild disease, but now continue to suffer with long haul symptoms.
Interesting. So these treatments out there, obviously the vaccine, you've said in some cases has helped. In some cases, it's actually made these symptoms feel worse for people. But any treatments that are out there for, or therapies even for people who have long COVID, anything they can do?
Yeah, there's no FDA-approved treatment specifically for long COVID right now, but what we're really doing is targeting treatments to the specific symptoms that patients have. For example, we have some drugs that are really good at treating the heart rate and blood pressure irregularities that patients have. Some patients do benefit from structured rehab, either breathing rehab or physical rehab. We're doing a lot with breath work because we know that breathing really impacts both the heart rate and also the sensation of chest pain and shortness of breath.
If someone...
but really, it's just... I'm sorry?
I'm sorry, you broke up a little bit there. Go ahead.
Oh, I'm just saying that we're really focusing on, yeah, the physical rehab and breathing rehab are really important, as well as providing strong emotional support, behavioral health support to deal with all the psychological symptoms that patients are suffering from.
Doctor, if someone had COVID and they're just not sure if they're technically a long hauler, I know that fatigue is one of the symptoms. I've heard from some long haulers that it's a real heavy fatigue. If someone's not sure if what they have constitutes being a long hauler, should they be checking in with their doctor?
Absolutely. They should be going to their primary care doctor and sharing their symptoms and sharing kind of the time frame of their symptoms, and asking to be evaluated for long COVID. At our clinic, we also accept self-referrals. So patients who maybe don't have a primary care doctor or having difficulty getting referred to a clinic like ours, we accept patients to self-refer so that they can be seen.
Doctor, someone watching this right now that has a few more questions, wants to know more, where can you send them?
Sure. So they can visit our website, and they can call and schedule an appointment, or ask their doctor to schedule an appointment. And we have some resources on our website as well with further information.
You can go to health.ucsd.edu and then look for the long hauling information there. Doctor, thanks so much for your time. We really appreciate you walking us through this. We don't want to see the long haulers out there. We know they're there, but we know there's doctors, there's treatments, and there are options available. So thanks for walking us through all of that here this morning.